So I think believe now it's time for Q&A. I guess we have a couple of surveys, but I do want to kick things off with Dr. Sassoon. Really a great lecture, and had not realized, I knew about the controversy. I didn't realize that the data was pretty definitive from what you're describing. First, I guess there are two practical questions. First is how long would you recommend waiting to patients before they undergo a spinal fusion after their hip replacement? And the second is I noticed that a lot of your data was like based on surgeries done before 2012. I'm wondering if the anterior approach, which seems to be really emerging as kind of a preferred approach, whether you think that'll make a difference in this dislocation risk.
Sure. I think those are both really good questions. Ultimately, I think that to address your first question, I think if the patient's able to, waiting a year would be a good idea. I do posterior approach, and I have patients on precautions for 3 months, but I think patients achieve their sort of maximal recovery at about a year from surgery in terms of their strength and their stamina. But it's not always the case that a patient can wait that long. If there's pressing matters, I would say a minimum 3 months, but certainly if they're symptomatic, somewhere between 3 months and a year. If they're having very minimal symptoms or could be managed conservatively for a year, I try and get them out a year from their hip replacement. With respect to the anterior versus posterior approach, I'm a little bit biased because I'm a posterior approach guy, and I find that the positioning of the implants is the most paramount thing. Because really, in the cases where patients are dislocating with spinal deformity, it's a matter of bony impingement. And it's a matter of component placement. It's a matter of being able to trial implants. And I think all of those things are sort of facilitated by a posterior approach. I think that the anterior approach avoids potential immediate hip precautions for the average patient, but there's been no data really in the hip arthroplasty realm that suggests that an anterior approach in and of itself in these patients is preventative of dislocation. I think component placement using potentially dual mobility implants is going to have a much greater impact on patient outcomes.
Great, thank you. Hopefully I have some more questions. I do have some specific questions for each of your talks, Tom, John, and Raymond, but I think it's a great transition because we are just talking about total hip arthroplasty, which is arguably probably the most cost-efficient and clinically efficacious interventions that we have in all of medicine, not just in orthopedics or in surgery. And then we're talking about deformity surgery, where we're talking about surgeries that are certainly evidence-based, but have immense costs on the system. And I know you're all at academic centers, which means that maybe you're insulated from these things, or maybe it's your job to take on these cases, but you're also thought leaders being there. Just wondering what your take is on that, because we're in a era of diminishing resources and where we have to make decisions on where we're going to allocate those resources. And when it comes to spine surgery, should we be devoting these resources to more MIS lifts or bigger deformity surgeries? Tom, do you want to take this on?
Sorry, I was unmuting there. No, I mean, James, I think that's a reasonable question, and I think in this era of where we're looking at things with perspective of finite resources, it's a valid thing to ask. But I think when you look, I can't remember the exact year, but Raj Ramprasad did a study looking at the what you gained in terms of quality of life outcome measures, and really a lot of the spine surgeries in the deformity patients were at levels pretty close to total hip and total knee replacements, which we sort of always think of as a gold standard. So there is really ability to I think provide a lot of value here in terms of a limited resource environment, and I think we're not necessarily at a stage where
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.